So, so the first one is related to some imported cases from students studying abroad from maybe UK, US, and then the second peak is the most worrying peak at that time because there were many clusters in the institutions and also there's a nursing home, and then most vulnerable people are the elderly. So there are also many mobility party cases in January to August last year. And then there's another peak from some private dancing clubs that's also the same groups. And then you can see now until now probably died down. We only have maybe a number of cases every day, and most of them are some imported cases from other countries. So here we can try to understand how the different cases may affect the pandemic or outbreaks in the country, and then it will help us to guide some of our plan of action in Hong Kong Red Cross team. So in Hong Kong, most people affected are mainly the adults and also the elderly, and also there is a study from Hong Kong New Faculty of Medicine. They also found that the elderly have the highest risk for being infected as well as having complications or death. So we definitely know that the elderly are the most vulnerable groups of people in the COVID-19. But we also have to be aware that apart from physical health, apart from risk of infection, we also have to remember the mental health aspects because many people are highly stressed due to the COVID-19, and also we should never forget the people like the healthcare professionals, the youth that they cannot go to school, or the ethnic minorities that they cannot understand the health education materials well, and also some caregivers of the chronic disease patients. They are already in the normal time, they are already very stressed, have a high pressure, then during the COVID-19 they are even more stressed. So I will talk about some of the actions we've done in Hong Kong Red Cross. So mainly it's aspect. We have disseminated some the health knowledge, also distributed some masks, provided some emergency support for the people under quarantine. We also have some psychological support services and also some community health education hotline services. So I will introduce some of the key actions we have done. So the first one is to distribute some infection control kits to vulnerable groups of people. Vulnerable groups of people including the elderly, sick person living alone, some elderly aged 60, mentally retarded person, low-income families, and also the homeless, and also some primary and secondary school students. We also collaborated with more than 270 suddenly, because we have some lots of people having chronic disease, because you've mentioned many the adults and the elderly people, so they cannot go to the hospital or the clinic to have the medical visit. So we also help them to collect the prescription drugs at the appointed hospitals and clinic, so they can continue their drug regimen. And as I mentioned, we also recognize the need of some mental health and psychological health services. So we have one psychological support called Shall We Talk. You can call us or send a WhatsApp to us to book the appointments of some counseling or some check with our clinical psychologists or trained volunteers. We've also prepared a lot of psychological support services leaflets to different target groups. For example, the family, healthcare professionals, first responders, elderly, people who are being quarantined, or even the general public. And we have also prepared it in many different languages. As you can see on screen, there are also versions for the Indonesian. So I think you guys can download it later. Yeah. And moving from what we have done specifically for the COVID-19, maybe about the health education, distribution of the mask or some sanitary items, and also psychological support, because we can see that the pandemic is slightly died down in Hong Kong, and we think that we are moving on another stage that we have to think of about recovery, how we can have a better connected coherent society in Hong Kong. So we have a new plan, a 2-year plan called the Integrated Recovery Plan for Social Unrest and also COVID-19. We strive to enhance the community resilience in 3 aspects, including the health, self-sufficiency, and also cohesion through different services and programs. And Hong Kong Records have dedicated more than 1.2 billion US dollars in these projects. So this project mainly targets on 2 groups of people, including the first one is the youth, another is the low resources person. So for the youth, we have some humanitarian training program for the university graduates. We also have some enhancement of disaster risk reduction elements in the school health ambassador program, because in the past we have some school health ambassador program under the university group, and then we have included the disaster risk reduction elements now. We also targeted people, the teenage people, including university students and also other young people. We provide them some psychological first aid training, YBC training, humanitarian law training to them. We also have some social support training for people working with youth. For example, the teachers, the social workers, and then they can further help those youth under some mental distress in COVID-19. So while for the low resources person, we have some food vouchers for them, for the low income and also ethnic minorities. We also scale up some of our previous programs. For example, in the past, we have some mobility and personal care equipment support for the people in need. They can take those mobility equipment from the hospital, but then now we can already send those equipment to their home. first one is you can be the volunteer to help. In the first previous stage of the COVID-19 in Hong Kong, mainly the Red Cross colleagues, the staff to provide some help. But then we also move on to another stage to invite more youth volunteers to help. Maybe they can help to pack the sanitation materials. Maybe they can help to deliver some of the health talk, and then everyone can have a role in the COVID-19 services, and this can also help us to empower the youth. And then I believe this will definitely help all people to achieve a better conditions that we pursue. So lastly, hope that we can first thing go to have a COVID-free world, and then thank you for your attention, and then I think I can have the questions from the floor. Thank you.
Thank you for your introductions. This is very discussed. I believe we can learn and understand that in Indonesia as well. So I have a few questions that I want to ask you. You say that you are really focused on youth, but how does youth facing the situation of COVID-19 pandemic in your country? And how do you invite the youth to come and be a volunteer in Jakarta?
Thank you for your question. So I think for the youth, maybe we can mainly target on the rescue first. Why I say that we can invite them to help.
Although maybe there's some infection concern, but at the same time, because of the COVID-19, they originally have a lot of different youth programs, training, activities, and also they can meet their friends because in the events. But then because of the COVID-19, everything was cancelled, every event was cancelled, and then they lack the human touch or some interaction between each other. And then many people, they just at least some people that I can get contact with, they say that they want to help, but then they don't know what they can do. In fact, there are many different ways for them to help. For example, we encourage them to prepare some of the health applications on social media, so they can post it in their Instagram or Facebook, and then share it among the youth, and encourage also other people not in the Hong Kong Red Cross. They can also get to know more about the health education. And also at the later stage when COVID-19 is slightly controlled, and also not in a high risk, then we can invite some of the youth, maybe the university students. They can help to prepare the materials to distribute it to some homeless people, low resources people. And then I think they always have a role to play. And then we don't have to, we should not miss them. And then sometimes we have in mind that they should be the people who protect them. But then at the same time, they can also contribute to our actions in practice.
Okay. And how's the training goes for the youth in Hong Kong Red Cross? Because as we know, we can meet them face to face. So do you do online training or something?
Yeah, I think most of the training program will have moved it from the face-to-face to online. I think everyone is familiar with some Zoom training. So we also have put some of the materials through the YouTube, so they can view it when they are free. And then we also have some innovative activities, for example, while meeting each of us face-to-face, then we can do it in our home, and then try to also maintain the disease pattern series. We also have some movie screening. Maybe not everyone stay in the theater, but then we can enjoy the movie at home and also discuss some of the contents afterwards. Some sharing nature. Also have different types of the online exchange with other people from other countries. For example, Japanese Red Cross. So we hope that we can still maintain some types of the interaction between the Red Cross team and also the in Hong Kong and also from other countries.
Okay. Let's talk about community. You said before that one of the lessons that you learned is community recovery. And when a community have the same mindset about something, in this case, how to handle COVID-19, it might help them to minimize the spread of COVID-19. Is there any program there to help strengthen the community response?
So, pardon, so are you asking when the community there are lots. Do you mind to repeat your question? I'm not sure if I get the point.
Okay. The question is there any program there to help strengthen the community response?
I think so far there must be some challenges when we try to push this integrated recovery plan because at least, for example, we know that many people are in need, and then how we can prioritize which people we should help, and then this will be one of the challenges, and also how we can engage more people in this recovery plan because we have limited resources, and then maybe everyone has different minds how we can help the community to do it. So apart from what we have introduced, we also have some funding program, and then the breakfast youth and also volunteer staff, they can propose some of the services they think it's very useful, very important in their community, and then they can write a proposal, and then to get the funding to do it. Yes, to get the funding to do it.
Okay. So I want to ask you about protection for the volunteers. Is there any protection there for the volunteers in general?
For the protection, for the protection, we will provide them. For example, like the one I have done before, for some health education and also distributing some masks. We have the face shield provided for us, and also some hand up for us to do it. And also we have to sign a form. Saying that we don't have the symptoms, so try to protect those people who volunteer for help. But then because I think for people who like what I've mentioned are distributing the items to the quarantine center and also try to get the medication from the hospital and clinic. They will have a more higher level of the protection materials. For example, maybe some of them will have the PPE, but then for the general services, we don't provide that for the volunteers.
From the hospital level, for the
I'm sorry, there must be a trouble with your connection.
Yes.
Okay, sure. For the
For
general
volunteers,
for example, we did some
health education retreats. We'll have the face shield provided for us and also the hand up. But then
for the people, like they have to distribute the items to the quarantine center or for taking the medications from the hospital or clinic, they definitely had a high risk. So they will be provided the PPE. But then for most volunteers, face shield and also hand wrap is already enough for us. So we didn't provide a PPE for them.
Okay, but what if the volunteers get affected by COVID-19? Is there any protection that were provided by Hong Kong Red Cross?
So are you talking about the island people or the volunteers?
Volunteers that were affected by COVID-19. the volunteers?
I think so far we're lucky that there's no volunteer getting infected from the COVID-19 because of our action. So so far we don't have this concern. At the time when there are much more cases, we would slightly suspend some of our services, try to minimize the human touch interaction between the people, and then we would not invite the volunteer to help. Only the staff will have to do it, so to minimize the risk.
That's very good. So I want to ask about vaccine. You also talk about vaccine in your presentation. And vaccine is really important to create herd immunity. And there are a lot of variants of vaccine out there, such as Pfizer, AstraZeneca, Moderna, Sinovac, and etc. And what is Hong Kong Red Cross do to support the administration of vaccine in your country?
So in Hong Kong, because the administration of vaccines are governed by the Hong Kong government and also Department of Health, so Hong Kong Red Cross does not have any role in the administrating the vaccine, but then we also provided some of the vaccine education to the public, for example, to correct the misunderstanding of the vaccine side effects, or to also provide some of the health talk services. If there any inquiry about the vaccine, they can also call us to contact some of the nurses and also train volunteers to understand more about the information of the vaccine. But then for the administration, for like providing or injecting the vaccine, we do not help it in this way. Yeah.
Okay. So we know that we cannot work alone, and we need to work together. We have to have support. So how do you collaborate with the government of Hong Kong?
I think mainly from their request. So I can give you one more example. When we have some universal testing of COVID-19 in last year September, we received the invitation from Hong Kong government to ask if we can also help to organize a station to provide some of the testing services in Hong Kong. So we have some volunteers and staff to hold a session in some districts, and then we mainly helped on some administration and also the testing, the sampling, collection services. But then for the laboratory setting, those services we didn't do it. But then we would collaborate with the government by on request. And then so for the vaccine, because they already have a very well trained teams to administer the vaccine, so we didn't do it. But then we try to fill in the gap, like because we know that there like homeless people or ethnic minorities people, maybe they cannot receive the health education materials well. So we try to cooperate with some local organizations to provide more help to those people. And then we try to fill in the gap that the Hong Kong government may not have the capacity to do it.
Okay. So what about the private sector? There are maybe a private sector in Hong Kong that focuses on disaster risk management that might want to help in the management of COVID-19 pandemic. How do you get them involved in your program?
So I think for the private sector, because I think in the past, Hong Kong Red Cross also didn't have a very usual cooperation with the private sector, because we're also worried about the vested interest or some conflict of interest. So we don't have much cooperation with the private sector. But then I think in the COVID-19 or maybe the integrated recovery plan, we also received some of the donation or funding from some foundation or some fund. So I think for the private sector, at least in Hong Kong, they try to do it in this way. Yeah.
Okay. I want to ask one more question. What is the biggest challenge for Hong Kong Red Cross in the term of managing the pandemic? I imagine it must be very confusing at first, as it is the first time something like this happened for all of us.
Yeah, I think the most the biggest challenges for Hong Kong Red Cross is same for all people in the world. That is the first epidemic that we have faced so far. I think because Hong Kong maybe have a previous experience for the SARS, then maybe we are slightly more experienced on how to do the health education or materials distribution. But then COVID-19 is much more pandemic or affecting much more people than SARS, so we cannot compare it. So I think for the biggest challenges is to how we can respond in a faster way. And then I think because we have set these goals earlier that in about 2018, because we are Hong Kong Red Cross plan to provide more active and also faster response to the local disaster services. So we have already some of the planned for that. So, but I would say that for the COVID-19, it's not originally in the local disaster plan, but then because we have this mechanism, and then so we can try to respond fast when there's the outbreak. And also, it's very important to collaborate with other local organizations, because they in every district, maybe the local organization will be more familiar with the need in their district. And then we can also ask them to help to also facilitate the education and also distribution of the materials in a faster way.
Okay, thank you, Phoebe, for the answers. It is really inspiring, and we might take a lesson from here that might help Indonesian Red Cross to become further advanced in humanitarian efforts. Now, are we provided with question from Facebook? Yes. Okay. There is a question from Facebook. Oh,
yeah.
No. Okay. We don't ask the question, so we can move to the second speaker. Thank you, Phoebe, again for the.
You're welcome. Thank you.
And now let us move to the second speaker. Please welcome Akif Emre Aktas from Turkish Crescent. Good morning, Akif. Akif, can you hear me? Akif, good morning. Can you unmute the mic?
Okay. I think maybe there's some internet problems. Oh, okay, great.
Hello, good morning.
Okay, good morning, Akif.
Good morning.
Have you eaten your breakfast yet?
I hope you can see my screen and then you can hear my voice as well.
Yes, we can hear your voice very clearly.
Okay, good morning from Istanbul, Turkey, first of all. Selamat pagi. Actually, it's 7:30 here almost, so it's a bit early. So if I make any mistake, I'm so sorry because it's quite early here.
That's okay. Now you can share your information with your presentation.
Yeah, sure. So at the beginning, actually, I would like to share you some basic information about how the current situation here in Turkey, in terms of COVID-19 situation, and what we have done actually in terms of COVID-19 pandemic as Turkish Red Crescent and Turkish Red Crescent volunteers here. Then I'll be waiting for your valuable questions to answer. If you don't mind, I can start my presentation. Should I start my presentation or?
Yes, you may start your presentation.
Okay. So good morning again. Thank you for the wonderful presentation of the Phoebe of Hong Kong Red Cross. Actually, I don't have this kind of detailed presentation. I'll just show some photos and videos, and I'll try to share some information as much as possible. Um, when the year of 2020 was like a really emergency year for Turkey. And we call the year for the year of disasters. Not only the COVID-19 pandemic, actually, we start the year with the earthquake here in Turkey. So after the earthquake, we had a floods and then pandemic, and then we had another earthquake here in the country. And since that day, since the first day of the 2020 till now, it's been almost 2 years. We had many disasters and emergency situations in the country. I don't know, maybe you saw that in the news. Till last month, we had a also wildfires and then floods as well. Um, so since the beginning of 2020, we are fighting with the pandemics and as well as other emergency situations. Currently, we as a Turkish Red Crescent have officially, this is the official number. Of course, out of this number, we have much more volunteers, but we have 156,000 official volunteers, and the number of active volunteer is 63,000. During the pandemic, we worked almost 200,000 volunteers in the field. So we tried to go every door, every apartment building as much as possible in the country. When we come back to pandemic, um, when we come back to pandemic, of course, nobody knew that what we had to do about the pandemic because we were really stranger for the situation, and we started to inform people by distributing some booklets and leaflets and try to educate people as much as possible. As you can see here in the photo, our volunteers went out and tried to inform people. Not only on the streets, but also we use social media very active during this pandemic situation to inform people how to respond to this pandemic and how to keep their social distance, how to wear face masks, etc., and protect themselves, etc., and etc. Also, according to state's emergency plan, I mean the Turkish state. Let me give some information about it. Turkish state has of course, every states have their own plan on pandemics or emergency situations. In Turkey, we call it state's pandemic, state's emergency plan, and according to that plan, Turkish Red Crescent has a role for the fooding. So in every emergency situations like earthquakes, pandemics, floods, etc., Turkey Red Crescent actually responsible for the fooding. In this pandemic situation, also we were responsible for the foodings, for the meals. As you can see here, our volunteers are distributing some meals for the people who are in quarantine in dormitories. As you can see here, also we were preparing the food package for the people who were not able to go out due to pandemic. Of course, we were assisting the other organizations, not only the Red Crescent branch and Turkish Red Crescent, but also our partners who uh, we were in need during this situation. Um, Under the local authorities, also not only the national level, but under the local authorities during this pandemic, we had a um, groups in every district called VEFA. VEFA means like loyalty or something. And also Turkish Red Crescent was part of these organizations, municipalities, uh, and some other local authorities were finding the people who were in need, and Turkish Red Crescent and other partners were providing their needs. You know, we had a really tough situations, especially because of the curfew. People were not able to go out, and on behalf of them, our volunteers were going to markets and bazaars and getting their stuffs and providing what they need. Um, in last 2 years, we had, you know, in Muslim countries, we have a year, the holy month of Ramadan. So even that time, there was a curfew, and people, as you can see here in the photo, were providing water and bread, which is our main meal here. So they were providing their basic needs in the streets. Um, of course, we learned many things in these situations, especially we learned as Phoebe explained, that the importance of the mental health. Um, because without mental health, actually, we are not able to take action. We lost our friends, we lost our volunteers, we lost our relatives in these situations, and we have to keep our mental health, and that is the key. Also, what we have learned is that the importance of the social media and social platforms like Zoom. I mean, currently we are here and connecting us via social platforms, and it was not that popular even before the pandemic. So we learned that actually it is really important and it is very useful, to be honest. By the way, I forgot to explain that during the pandemic, we had our own platform called Gönüllü or TR. It means Gönüllü means be a volunteer or something. We created our own platform. I mean, I don't know if you want to, you can check it out. Um, you are creating your own account, and you can find like the duties on the website. And if there is a need of volunteer in Istanbul or in Ankara or in Bursa or in other district or province, you're just texting your informations, your personal informations, and you're able to go to the field to assist the volunteers. I mean, you learn how these social platforms actually are useful. Um, and the last thing also, it was really important for us. This is what we learned, to taking rapid actions. I mean, sometimes we really don't have the time to take actions, and we always should be prepared for the pandemics, for the emergency situations, etc. and etc. Uh, Actually, this is what I can say so far. Uh, Let me give some information also about the current situation right now here in Turkey. Um, yes, according to the yesterday's data, we have a 27,692 people who already have a COVID-19, and I mean, how to say, um, the rate of the first dose of the vaccination is 84%, and second dose is about 68%. So vaccination process is actually going really fast here in Turkey. and so far we don't have a like any problem about the vaccination process, and it's going really rapid. So thanks for listening. Actually, I can share a video at the end if you don't mind. Okay.
Thank you, Akif, for sharing the information.
You're welcome. So I have just like a
Okay.
short video, just a minute.
Okay.
Yeah, thank you for listening me and watching the video. Thank you so much.
Okay.
Yeah, I think I'm done.
Okay. Thank you, Akif, for your information. It is really inspiring for us. So there are some questions that I want to ask to you. Just 2 months after the first outbreak in Hong Kong, I heard that the first outbreak of COVID-19 in Turkey was on 11 March of 2020. Can you tell us more about that? How was the situation when the first outbreak happened?
Um, uh, can you repeat the
Can you
question?
hear me,
Sorry,
Akif?
yeah, I can, but I couldn't get the question.
Oh, I'm going to repeat the question.
Yeah.
Tell us more about the first outbreak of COVID-19 in Turkey, which was happened on 11 March of 2020.
Yeah.
Can you tell us more about the first outbreak of COVID-19 in Turkey?
Yeah, sure. Um, Actually, we started, as I said, the first outbreak in Turkey has been seen on March 2020, as far as I can say. And uh, when we compare to other countries, like our neighboring countries, like Iran and Georgia and other European countries, we got the uh, first COVID-19 case quite late than others. And since our health system is like quite good, actually, it didn't become an outbreak very soon. But uh, after few months, we saw that number of cases are going really high, and then on June 2020 and July 2020, it became an outbreak. And yeah, so that was the time that we had it became an outbreak. But yeah, thanks to our health workers and social workers, the situation is like under the control here.
Okay, thank you. So I want to ask about youth. We know that youth is very important, but how does youth, especially in Turkey, facing the situation of COVID-19?
Yeah. Um, I mean, not only in Turkey but Crescent, but Turkey is like really young country. Almost almost 65%, 70% of the country is consisting by the young people. Um, so the um, average age of the country is about 25 or 26 or something like that. So Turkey is really young country, and of course, in this kind of emergency situations, young people are really important, especially to take a really rapid actions. So as I said, we worked with 100,000 volunteers in the pandemic, and since they are able to spend much more time than elder people, we really get benefited from the young people on the street. Even their health situation is like more suitable than elder people. So it was really important to mobilize the young people during this pandemic and other emergency situations. um, Even
Okay,
I can share the exact number of our rate of the young volunteers. I actually explained our number of volunteers. It's currently 156,000 volunteers we have, and we have 227 volunteers under the 15 years old. Okay, they are between 0 till 15 years old, and we have 2,650 volunteers between 15 and 18, and we have 43,000 volunteers, even 44,000, let's say, volunteers between 18 and 30 years old. When we come to 45 years old, number of volunteers are like increasing. So actually, this young volunteers actually the main pillar of our volunteer capacity, I can say. So without youth, actually, the whole system is just like collapsing.
okay. There must be a lot of volunteers in Turkey. So I want to ask, how do you train them in this pandemic situation? Because
Yeah,
we know we cannot meet face to face, right?
yeah. Actually, of course, it depends on the period because at the beginning the whole restrictions was like really tough, but then now we are normalized and now we can give their trainings in person. But at the beginning, we were all afraid and we didn't know what to do. It was the same in Indonesia, in Hong Kong, and as well as in Turkey. We started to train them through social platforms. We used our social media a lot, as well as we have our own system. Actually, I explained Gönüllü or TR. Actually, the platform is like a social media. You're creating your own account, like a Twitter, like a Facebook, and then you're writing your capabilities. Like um, you can share your information and you can get the training videos from there. And when you completed that videos and then lessons, you can get the certificate through that website, and then you can use it when you attend the um, events or these kind of uh, programs, let's say. So we used our social platforms a lot, I can say, if it was possible, because after 1 year it was possible to train them face to face. we did it face to face as well.
Okay. Now I want to ask about community. How do you, is there any programs in Turkish Crescent to strengthen the community response?
Yeah, sure. Um, as I said, actually, community resilience, community response is like the basic for the humanitarian disaster, humanitarian operations, and all kind of natural and man-made disasters. Uh, so without community resilience, actually, all our works actually is like nothing. Um, to increase the community resilience, actually, we also train the people who really want to join our events and programs. Uh, we have social support groups. They went the people and they provided social supports as well. And if they wish to join our activities, we also train these people and they became part of the Turkish Red Crescent. Actually, that was the main trick to increase the community resilience. And yeah, this is what I can say. Also, not only Turkish Red Crescent, actually, uh, there are a lot of NGOs and governmental organizations as well as non-governmental organizations which working in this kind of sectors. So I mean, not only the Turkish Red Crescent, but our partners also was like really important in this kind of issues.
Okay. Thank you for your information and answers. It is really inspiring. So now I'm going to ask both of you the same question. There are two questions from our followers. So maybe Akif can start first and then Phoebe can answer later. So the question is, the first one is, what is the technology approach from the Turkish Red Crescent or Hong Kong Red Cross that you can provide to tackle the pandemic of COVID-19? Akif, maybe you can answer first.
Okay, so sorry if I understand correct. Technological approach you said, right?
Yes.
Okay. Yeah, I explained that a bit. So, we we learned that during that situation how to use pandemic. But the problem is that I can't. I mean, if you don't mind, I don't. I just want to point out another point of this technological approach. Actually, there are many challenges also using these kind of technologies here. During the pandemic, what we have faced is that disinformation. Um, because when we use the social media a lot, we face a lot of disinformation about our works, our events, our responses. Um, so using social platform and technology and these kind of issues of course is really important, but on the other hand we have a different problems like, as I said, the disinformation. So this affecting our mental health also and the motivation of the volunteers as well. Let me share a story. I don't want to steal the time of Phoebe, but um, while we are working, while our all volunteers working on the field, we saw some fake news about Red Crescent or Red Crescent volunteers. And some of our volunteers didn't want to keep their work because of this kind of disinformation. So what I can say is that of course using social media and these kind of social platforms are like really important, but also we need to know that of course these social platforms can be dangerous and can have a really bad effect on our works and our responses. Uh, this is what I want to say. Of course, using technological stuff is like really important. Uh, right now, we are having a meeting through technological platforms as well. We use Zoom, Microsoft Teams, Google Meets, etc., etc. We benefited, we utilized a lot. So, and now we learned that actually these kind of platforms are like really useful. I mean, to be honest, I didn't know that platforms before, and we all learned that this is actually how important. So yeah, actually that was the benefit of the pandemic, I can say.
Okay, thank you so much, Akif. And now, Phoebe, maybe you can answer what is the technological approach that were provided by Hong Kong Red Cross?
Thank you. So I think I share a lot same idea with Akif, because I think we don't actually have a very concrete technology approach to tackle the pandemic. But then while in the pandemic, there are a lot of face-to-face activities suspended or cancelled, and what we can do is to try to put everything online. So we have online chat, we have online talk, lecture sharing. We also make good use of the social media to disseminate the health education materials. I think what we have to be aware is some people may be left out, because especially people with who don't have a good internet access, or they are not very good at using the internet tools. For example, because we are trying to manage our services also online. For example, in the past we have some elderly home visits face to face, but then we now try to do it in technology way. We have a group of volunteers maybe in the Red Cross Center, and then the elderly stay in the elderly home, and then we use the Zoom to play some games with them. I think this is quite different from the past, because it still lack of the personal human touch with each other. But then at least we find that there's some new normal way for us to maintain the communication or the connection between the people in the society. And then I would say, because of the COVID-19, we have modified a lot of training program or materials. For example, we have tried to do the YBC online. We have do more IHL education online. And then I think this is just like providing us some leeway or insights of how we can do it in a more better way, or to spread the information to more people, because many people can now get online information for a while, and then maybe it can be no longer limited to the Red Cross youth, Red Cross volunteer, but then more to the public, how we can make good use of this internet or online platform to do it. So I think this is also something we learned during the COVID-19.
Okay, thank you for the answers. But unfortunately, because of the short time, we can only ask one question from the followers, and that is it. Thank you for all the speakers and all of the followers that have come to our talk. I hope that international community talk, management of the COVID-19 pandemic, can help us gain new information, and we can implement that into our response in the term of handling COVID-19. Me, Safira Tasha Asadel, as your MC today, would like to apologize if I have any mistakes. Good afternoon,